Welcome to Essentials of Pharmacology for Health Profession, 9th edition. Chapter 3 will be discussing sources of bodily effects of drugs. Upon completion of this chapter, you should be able to identify the 5 sources of drugs, contrast systematic and local effects, define the pharmacokinetic processes as they relate to the passage of drugs throughout your body, state the conditions that may decrease the effectiveness of each pharmacokinetic process, which includes absorption, distribution, metabolism, and excretion. Discuss several variables that can affect drug action. Define various adverse drug reactions and describe the various routes of drug administration. Any chemical substance that is ingested or applied with a purpose to affect our body function is referred to as a drug. In earlier times, many of these substances were found in nature, like plants, berries, bark, leaves, resins from trees and roots were considered a prime source of drugs and still is useful today. Minerals from the earth, to include the sulfur, iron, potassium, silver, and gold, are also helpful and are utilized to manufacture drugs. Now we have synthetic manufacturing, we have genetic engineering with advanced technology has opened the door for in-depth research and experiments bringing forward effective and safe drugs and the ability to treat illness and discover cures for current medical problems. Research led to the use of substances from animals to effective drugs. Substances lacking in the body can be replaced with similar substances obtained from the glands, organs, and tissues of animals. Now, I want to talk about the chemoinformatics just for a minute. Chemoinformatics is the application of computer technology, statistics, and mathematics to study the information about the structure, properties, and the activities of our molecules. This method is probably the most actively pursued source of drugs by major companies today. Now, our genetic engineer, which I mentioned earlier, genetic engineering. So we think about genetic. So genetic engineering, what it really does is refers to the alteration of genes in any laboratory setting. Just wanted to add that in there for you. What we are looking at is a table of our sources of drugs, which is located in our ebook. It's just in a table format, which is easier. And it also gives you a visual so you can see it. Make sure you read it. Let's check your knowledge. Vaccines are produced from which drug source? Pause the video, look at your choices, and write your answer down, and we'll check it at the end. When we talk about the effects of the drugs on the body, we have systemic effect and we also have the local effect. Now, let's see what the systemic effect does. It reaches widespread areas of the body because the medication reaches the bloodstream and it is carried out through the body. Your example would be taking Tylenol for a headache, and that can assist with any pain management in other areas of your body. Now, the local effect is limited to the area of the body in which the drug was administered. So an example of that would be like a topical cream would only work in the area that you applied it at. Check your knowledge activity. The question is, examples of a systemic drug effect versus your local drug effects includes all of the following itself. Look at your answers, pause the video, write your answer down, and we're going to check it at the end. Pharmacokinetics is a process in which a drug moves through the body. When a drug enters the body, it undergoes many changes along the way. The 4 drug processes include absorption, which is the passage of the substance through a membrane into the bloodstream. Distribution is moving from the bloodstream into the tissues and fluids of the body. Your metabolism, which is your physical and chemical alterations that the substance undergoes in the body. And then excretion, which is eliminating waste products of drug metabolism from the body. We are looking at Table 3.1, processing of drugs within the body. Absorption, the primary site of process is the mucosa of the stomach, the mouth, small intestines, or the rectum. Your blood vessels in the muscles or the subcutaneous tissues are the dermal layers. The conditions that it may alter the process is incorrect administration may destroy the drug before it reaches the bloodstream or its site of action, like, for instance, giving certain antibiotics after meals instead of on an empty stomach. Distribution refers to your circulatory system through capillaries and across the cell membranes. The conditions that may alter the process is poor circulation, which can impair the flow of blood, may prevent the drug from reaching tissues where it has to leave its desired effect. Metabolism, which is your side is your liver, your small intestines. And the conditions that may alter the process is hepatitis. You have the cirrhosis of the liver or damaged liver, which may prevent adequate breakdown of the drug, thus causing a buildup or accumulation of unmetabolizing drugs. Your excretion was to exit. That would be your kidneys, your sweat glands, your lungs, your intestines. Your renal damage or kidney failure may prevent passage of drug waste products, thereby causing an accumulation of the drug in the body as well. Alright, so we're going to look at absorption. The site of absorption varies according to the physical properties of each drug. So let's take a look at pH, the pH of it. Acidic, natural drugs are absorbed well with the acidic stomach environment. Like your alkaline pH drugs are not absorbed well through the stomach, but are absorbed in the alkaline environment of the small intestines. Your lipid, which is your fat solubility. The substance high in lipid solubility are quickly absorbed through the mucosa of the stomach. Your alcohol-containing substance are soluble lipids. They rapidly absorb through the GI tract. Substances low in lipid solubility are not absorbed well through the stomach or intestinal mucosa and are absorbed best when given by means other than the GI tract. Your present or absent of food in the stomach. Food in the stomach tends to slow absorption due to slower emptying of the stomach. If a fast drug effect, a desire, or an empty stomach will provide quicker absorption. Some medications on an empty stomach is contraindicated as medication that irritate the stomach can be buffered by the process of food. Alright, so we're going to take a look at the distribution. The distribution refers to the movement of the drug from the bloodstream and into the tissues and fluids of the body that can also be affected by specific properties of the drug reaching the major organs. And it may depend on the drug's ability to cross a lipid membrane. Some drugs have the ability to pass the blood-brain barrier to reach the brain. Some drugs have selective distribution, which this refers to the ability or attraction of a drug to a specific organ or cell. Let's take a look at the metabolism. When transferred into the liver, a drug is broken down and alter two or more water-soluble byproducts. With this, the drug may be more easily excreted by the kidneys. Some drugs are inactive when administered and become active only when they are metabolized by the liver. This group of drugs is known as prodrugs. It is possible for some drugs to bypass the process of metabolism. When that occurs, they reach the kidneys virtually unexchanged and later be detected in the urine. Alright, so we're going to take a look at excretion. Most drugs are excreted by the kidneys via urine. It is possible that some drugs are eliminated through the lungs, which is, if we exhale the gases and anesthesics, or through perspiration, feces, bile, or breast milk. If a drug is not excreted, properly before a repeated dose is given, the drug forms a buildup which is called a cumulative effect. A cumulative effect is an increasing effect of a drug that is demonstrated when repeated doses accumulates in the body. Then we would have the issue of toxicity that results from exposure to either a poison or a dangerous amount of a drug that would normally be safe when given in smaller amounts. In drug therapy, the goal is to give just enough of the drug to cause the desired therapeutic effect. There are other variables that can affect the speed and efficiency of drugs being processed by the body, and these are your age, your weight, your gender, your psychological state, drug interaction, and your dosages. We know that patients are often prescribed multiple drugs. Whenever more than one drug is taken, it is possible that the combination may alter the normal expected response of each individual drug. One drug may interact with another to increase, decrease, or cancel out the effects of the other. The following terms are used to describe drug interactions.
Synergism,
which is the action of two drugs working together in which one helps the other simultaneously for an effect that neither could produce alone. Drugs that work together are said to be synergistics.
potentiation,
The action of two drugs in which one prolongs or multiplies the effect of the other. Drug A may be said to potentiate the effect of drug B. This interaction is often used in pain medication.
antagonism,
The opposite action of two drugs in which one decreases or cancels out the effect of the other. Drug A may be referred to as antagonist of drug B. It is very important that the physicians know all the medications that a patient is taking, and that will be our job to make sure. Doses can bring about variations of a drug such as the speed, action, or effectiveness. Dosage is defined as the amount of a drug given for a particular therapeutic or desired effect. Your minimal dose is the smallest amount that will produce a therapeutic effect. Your maximum dose is the largest amount that will give or that will produce a desired effect without producing toxicity. Loading dose is the initial high dose, often maximum dose, used to quickly elevate the level of the drug in the blood, often followed by a series of lower maintenance dose. If you've ever taken steroid drugs, you know you start at the very maximum and then you come down. That's an example. Your maintenance dose is dose required to keep the level of a drug in the blood at a steady state to maintain the desired effect. Your toxic dose is the amount of a drug that will produce harmful side effects or symptoms of poisoning. You have to be very careful with that. A lethal dose is a dose that can cause death. Hence, lethal dose. Therapeutic dose that customarily given and adjusted according to variations from the norm. An example would be an adult dose based on body weight of 150 pounds. Okay? We're going to check your knowledge on what you just learned. The question is, what is the correct process in which drugs pass through the body? Pause the video, write your answer down, and we're going to check it at the end. Check your knowledge. Your question is, which best represents selective distribution? Look at your choices, pause the video, and write your answer down. Check your knowledge. Your question is, which is not a common factor that can affect drug action? Pause the video, look at your choices, and write your answer down. We're going to check our answer. The route of administration is the most significant factor in the speed of drug action. There are a number of methods that drugs may be given to reach their destination. The most common routes of administration are grouped into two main categories. The two categories are integral or GI tract routes, which consist of your oral, which is by mouth, PO, nasal gastric tube, NG, and gastric tube, and your rectal, or PR, which is per rectum. Your peritoneal routes include your injection, which are your intravenous, intramuscular, subcutaneous, intradermal, intracardiac, intravenous. Your non-peritoneal would be your sublingual, transdermal, topical, ophthalmic, audit, transvaginal, nasal, inhalation. The picture that you are looking at on your screen is a figure of an IV drug administration, which is something that we do not do as certified medical assistants. There are advantages and disadvantages of the various administration route, and the physician will decide the route based on the desired effect, the absorption qualities of the drug, and how the drug is applied. Other general points to remember regarding the route on drug absorption is the oral route is the easiest. However, the effects are slower because of the time required for dissolution. Your intravenous route is the fastest because it enters the bloodstream immediately, like snap of the finger. Your peritoneal routes are chosen when the patient cannot take medication by mouth or the drug is not suitable for the GI absorption. Your intramuscular route is rapid as muscle is highly vascular. Intramuscular may be an option if the intent is to slow the speed of the absorption. Your transdermal route allows for slower, consistent drug absorption over time. Inhalation is fast acting due to the large surface area of the lungs and rich blood supply, which allows the drug to enter the bloodstream. It is time to check your knowledge. Oral route is the fastest and easiest method of absorption to administer medication. Pause the video, write your answer down, and we will check it after the lecture. We're going to take a look at the adverse drug reactions. Unintended effects of medication are known as side effects. This can occur for many forms to include cough, pain, tremors, headaches, dizziness, photosensitivity, and lab value changes. When harmful side effects occur, it is termed as an adverse drug reaction, and many times a change in drug dose and frequency is needed to prevent it. When we look at the term teratogenic effect, its reaction is an effect from internal drug administration that causes physical defects in a fetus. Your idiosyncratic reaction is a unique, unusual, and unexpected response to its drug. Paradoxical reaction is an opposite effect from what is expected. An example would be an agitation effect versus tranquility effect when taking tranquilizers. Tolerance is a decreased response to a drug that develops after repeated doses are given. That's like over a period of time sometimes. Dependence can produce psychological or physical symptoms of withdrawal, which can include your nausea, tremors, sweating, pain, and retching. Hypersensitivity is an immune response to a drug that can be mild with no immediate effects, more likely to exist in patients with other known allergies. Anaphylactic shock is a severe, possible fatal allergic response. Signs can be mild or severe and can include itching, hives, vascular collapse, shock, cyanosis, and difficulty swallowing. Okay. Look, what you're looking at on your screen is table 3-3 is the FDA drug pregnancy categories. They are category A, B, C, D, and X. And you also have a description with each of them. So we're going to take a look for just a minute at pregnancy category A. It is generally acceptable. Controlled studies in pregnant women show no evidence of fetal risk. When you look at B, it may be acceptable. Either animal studies show no risk, like human studies unavailable, or animal studies show minor risk and human studies done and show no risk. You go to C, use with caution if benefit outweighs risk. Animal studies show risk and human studies unavailable, or no animal or human studies done. You have D, use only in life-threatening emergencies when there is no safer drug available. positive evidence of human fetal risk. And then X is do not use in pregnancy. Risk and Bob outweigh all potential benefits. Do you think this is very important to know when we are checking the patient's medication? Yes, very important. So if we was to ever have an anaphylactic shock, a lot of times we should have an EpiPen on site, or if you are a person that has a lot of allergies, you should have an EpiPen on you always. But just to know, if you have no idea about EpiPens, they are utilized to treat severe allergic reactions, and they are super, super easy to use. We will learn more about those. Check your knowledge. Cyanosis and dyspnea are associated with which adverse drug reaction? Look at your choices, pause the video, write your answer down, and we'll check it in a little bit. Thank you for listening to the lecture. This is a self-assessment for you. You can ask yourself these questions. Can you explain the advantages and disadvantages of each drug administration route? What are the variables that can affect the speed and efficiency of drugs processed through the body? Can you describe the 4 processes related to the passage of drugs throughout the body? Knowledge check activity answers are on the screen. Check your answers, and if you got them wrong, check your ebook, look the answers up. If you have any questions, please call me, please email me, or ask me when we meet in class. Thank you.